Part 2 of special OSCE moments every student knows about. But this time it's clinical history edition, so tune in. Hey guys, it's Hassa Slayman and you're listening to Confessions of a Doctorholic. So if you haven't heard the previous episode, we were talking about OSCEs and the things that can go wrong. OSCEs are objectively structured clinical exams is how med schools examine our interaction with actors or simulated patients. We usually have a circuit of 5 10-minute stations with 2 minutes to read the instructions in front of the cubicle. So it's basically an hour long on 2 consecutive days. So apart from clinical exams, they also test our communication skills in a doctor-patient interaction, aka student-actor interaction. But during these stations, your Hollywood skills, if you have any, have to be 100%. And here are some things that happens when those go wrong. So imagine this. You've learned a structure to use on a patient because it's easy to remember and it makes sense in your head, and this will get you the point. So this is mine. Introduction, what brings you here today, and then if the patient says pain, drop in the Socrates. So site, onset, character, radiation, associated symptoms, timing, exacerbation, severity. And then I move on to other medical conditions, past histories, medication history, family history, and I like ending up with social history and then summarizing. Perfect structure, right? But then the actor decides to go off script. And I practice the structure, and you would think you're directing it because you're the one asking the questions, but it happens all the time. And then, if you interrupt, the flow sounds weird, which I always get flagged for. Anyway, something that always gets me is trying to explain things in layman's terms. It's because I don't really know what's medical jargon anymore. Everything's muddled up in my head. So to clarify this, I had to do a diabetic information giving station. And I'm trying to explain to the patient that insulin is a hormone released by the pancreas. But then I started tripping out. Is pancreas jargon, or does everyone know what pancreas is? I don't know. There's always a moment during your clinical history when the actor says his dog died. And then they pause for a second. They give you a moment for silence where you have to realize that's your cue and you need to get that empathy point. But I always struggle. It's not that I'm not empathetic. Let me explain. It sounds fake every single time. And I know it's because I'm overthinking the situation. Part of me is also it's an actor, it's not real. Sometimes I have that conversation in my head because I get really nervous. And I think someone at school also told me that you can't say, I'm sorry for your loss, because it's so cliche and fake. And something about saying sorry makes it sound like you're responsible and you could get sued or something like that. I don't know. But every single time, I feel like my empathy, not on point. I've never gotten that in feedback, but that's just how I feel about it. Okay, so this moment has happened to my friend and not to me. Apparently, he had to collect a social history in 10 minutes at a social history taking station. Anyway, so it's pretty straightforward. Go in, ask questions about the patient's personal life, about their family, number of kids, if they're married, their diet, if they drink, if they do drugs, etc. Okay? And it's kind of like Houdini's tricks for a med student, because you have to get all of that in 10 minutes, which goes by really quickly. Anyway, so he goes in, starts with it, and then the patient/actor starts crying. And I heard that was so nerve-wracking. But he simply asked the patient if he should stop and continue later, and he did what any med student should, and I feel like that's the best thing you could have ever done. And he nailed that station. Okay, so you would be surprised how quickly 10 minutes goes by. I mean, having said that, when you do finish early, you question everything because stress. And then when you finish late, it's like, was that really 10 minutes or not? So the examiner announces 1 minute remaining and literally gets me every single time. I stop, the actor, whatever they're saying, always happens. And I'm like, so I'm going to summarize now. Let me know if you want to add anything else. Always happens. Okay, so the only thing that doesn't make sense in my history structure, which I forgot to mention, is ICE. Ideas, concerns, expectations. I mean, when you ask your patient that, it helps with the direction you want to go in 10 minutes, but it sounds so weird. Like, when would anyone drop that in a conversation? And also, aren't they like similar things? Okay, my personal favorite. As part of your social history, you have to ask the patient if they drink alcohol or do drugs and about their diet. So I had a social history station and I asked the actor about drugs and alcohol and he laughed and said, no, like, of course not. Then we move on and ask about diet and he's like, oh, it's not too bad, and gives me a run through of what he eats on a given day. Then I summarize and ask him if he'd like to add anything and he's like, oh yeah, I forgot to mention, I do coke. So I'm sitting there thinking, but you said no to drugs. Anyway, so I ask again just to clarify. So are you saying you do coke, like the drug? And he's like, no, I mean coke. And then I'm like, okay, this is really strange. So I ask him again, I'm like, okay, can you describe it for me? And basically he describes a bottle and I'm like, what do you mean? And then he's like, they sell it in supermarkets, they sell it everywhere, you must drink it as well. And I'm just like, yeah, I don't drink Coke, I don't know what you're talking about. Anyway, he kept describing it and then in the end I find out he's like naming other soft drinks. So I realized he meant like Coke, like the soft drink Coke. Anyway, I probably should get my mind out of the gutter. And communication is everything, right? So let me know, have you had any interesting clinical history situations? By the way, guys, if you have any input, if you want to add some of your cool stories, then you can do so via voice message, kind of like the ones that you send on WhatsApp, except that will be on Anchor.